So sir, first is what is your role in hospital sitting as a doctor of pharmacology?
Actually, the thing is, in our India, they don't know who is pharmacy. The next case is emotionally. There, the medical or medicines can't work generally. So you are going and purchasing the ibuprofen and you're eating. But you are not knowing the ibuprofen is having some contraindication as well, side effects. That you are not checking.
Whenever they feel sick or whenever their body is going in the wrong way, they immediately approach to the drug.
To prescribe the drug or potent drug, okay, dangerous drug category. So generally nowadays in India, the antibiotics are not available from the shop. Without prescription only, they will give the antibiotics. Actually, we shouldn't give antibiotics without prescription. What is generic medicine?
Yeah, that's the main question.
How the generic medicine came? For that, we don't know why he took the drug. Generally, I'll say, our sleeping is 7 to 8 hours we should sleep. Again, if you're getting more tired or sleepiness, means your body is not having particular nutrition substance. Okay, if you are attacked by something, wait for 3 days. Because the goal, if you are using, you are depending to the particular substance. Okay, that's why the addiction is coming. Okay, so if you are getting BP, don't keep that in your mind. Okay, I said physically and mentally. So mentally you are setting it. Okay, so I got a BP, I will die. If I'm not taking drug, okay, I'll die.
Hello friends, welcome back to the channel of Clinical Care Insight. Today I'm very excited and grateful to have one distinguished guest with us. Today we have Dr. Vikas TB, a doctor of pharmacology. Dr. Vikas specializes in the field of pharmacology. He is also assistant professor at Dhanvantari College. He is also teaching in various medical and nursing colleges. Dr. Vikas is passionate about traveling and bike riding. Dr. Vikas, welcome to our podcast.
Thank you. Thank you for inviting me in your channel. Your channel name is Clinical Care Insights. Yeah, I saw you about channels and all, like videos and all I saw. It's really good. Yeah, you're doing great job. Yeah, then myself, I'm Dr. Vikas TB. As I said, I'm a PharmD graduate. It is a doctor of pharmacy, and I'm practicing as an assistant professor in the Dhanvantari Group of Institution. And now I'm focusing on pharmacology because, pharmacology, what is pharmacology? It is a drug-related world. Okay, we can say it is a drug world. Okay, so I'm interested in the drug world. I'm practicing the drug-related queries and how drug is inventing, how drug is acting in the body. Okay, regarding that, I'm giving the lectures in various colleges, and also I'm giving the lecture in pharmacy students as well nursing students, allied health students, etc. Okay, so here we are there to talk about some pharma talks, right? Yeah, we will talk.
Sir, usually before shooting any podcast, our channel team members, we done a small survey. But sir, this time due to our clinical postings, we are unable to go and interact personally with the students, with the viewer. So we use alternatives, and we done one small survey, online survey. And in that survey, sir, we got amazing responses. And I thank you all for all those responses, and sure we will address all those questions in our today's podcast. So sir, first is what is your role in hospital sitting as a doctor of pharmacology?
Actually, the thing is, in our India, they don't know who is pharmacy. Okay, so it is not like we are having 3 category of courses in the pharmacy degree. Okay, first one is a D Pharma, okay, diploma in pharmacy. The second one is called B Pharma, bachelor in pharmacy, and the third category is called PharmD. It is a doctor of pharmacy. Actually, it came in India, I think 2008. Okay, it is introduced in India. Actually, the PharmD is different from B Pharma and D Pharma. Okay, we are like a clinical pharmacist. Okay, we are not a pharmacist, we are a clinical pharmacist. Okay, yeah. In hospital, what we are doing means we are directly dealing with the physicians and other healthcare providers, and also with the patients. And we are like enquiring that whether they are like physician is giving the proper drug and the given drug is giving the appropriate outcome, or the right, why we are giving the treatment to cure the diseases, whether the particular drug is curing the disease in a proper manner or not. Okay, we are checking that why inquiring about the past histories and adverse drug reaction, adverse drug event, side effects, etc. A lot of things we will go through it, and we will gather a data. According to the data, we will design which drug is suitable for the particular person. Okay, because in pharmacologically we are having hundreds of drug for a particular treatment. Okay, from that we have to choose. Okay, each individual is having their own physics. Okay, so from there we are picking which drug is suitable for this person. Okay, which drug is suitable for a particular that patient or that condition, because each patients are having their own physical conditions. Maybe some people are having some liver problem, kidney problem, okay, heart related problem. So that time this drug will contraindicate with the conditions. Okay, so that time which drug is suitable, we are choosing it, and we are setting the dose, and we are giving. So then we will get the proper outcome. Okay, if we are getting the proper outcome from a proper medication, then we can control the economical rate. Okay, means we can reduce the price of or cost of the therapy. Okay, that's why we are there in the hospital.
That's a great role, sir. Means basically you are supervising the medications. You are providing the overall main like core concept about the medicine to the patient, to the physician also. Sir, our body is designed very sophisticatedly. It's a very selective machine. If one dimension of our body is physical, the other is emotional and spiritual aspect as well, but one dimension is it's mechanical. So whatever we put inside our body, it undergo one very, you can say, the very tight process, and anything we put in the body, it will not come out without the process. So sir, what happened when person take a drug in his or her body?
See, as you said, our body, okay, we are having the body that actually we divided into two categories. Okay, one is physically, one is emotionally, as you said the same. Okay, so physically case we can alter with the drugs. Okay, if the person or patient is suffering from any physical conditions, okay, that time we can take a particular drug, we can rectify it. Okay, but the next case is emotionally. There the medical or medicines can't work. Okay, there the support emotionally, the psychotherapies, okay, emotional support should be there. Okay, so as you said, the drug, okay, we'll come to the drug. So don't take drug. Okay, generally we are eating the food. Okay, food also same thing, drug also same thing, undergoing the same process. Okay, there is no difference in that. If you are taking the drug, your body is doing this. If you are taking the food, body is doing this. Okay, we will call it as pharmacologically, we will call it as pharmacokinetic and pharmacodynamic. Okay, that is happening in the case of food and also drug. Okay, when it comes to the pharmacokinetic, okay, there are, I think, 4 different processes are there. One is, we will call it as ADME process. Okay, absorption, distribution, then elimination, metabolism will happen. Okay, why I said metabolism last? Any idea? So the M we will keep it as last. I'll say why. ADE. Okay, absorption, distribution, elimination. Metabolism will come between. Okay, because metabolism playing an important role in the body. Okay, so absorption, in the case of absorption, and also see we are having different physics in this world. I think 700 crores above people are there. Okay, each are having their own body mechanism, because according to the species, according to the place where they are staying, okay, and according to their habits, how they are living, and according to their food, how they are eating, what they are eating, depend upon that their body is already designed. Okay, already designed. So in that case, the absorption, okay, so whatever you are eating, the process same, all 4 processes will happen the same. Okay, in case of absorption, the food material, whatever you are entered into the DAG system, So it will getting absorbed. Okay, there is anatomically it will get absorbed, then it is distributed, then it is getting metabolized, then it is getting eliminated by different systems in the body. Okay, digestive system, blood cardiovascular system is helping, and renal system is helping, okay, to this process. So that time what happens, the drug or food materials, it is absorbing and distributing and supplying all over the body. That is called pharmacokinetic process. Okay, kinetic process, what body is doing to the particular material. Okay, so next I said about the metabolism. Okay, so metabolism, it is happening in the liver. Okay, actually liver is a detoxifying organs in the body. Okay, so whatever you are taking, that will go to the liver. Actually liver will filtrate it. Okay, whether it is good toxic product or whether it is good material, okay, or it is not harming to the body, then it will circulating all over the body. When it is toxic content, the liver will segregate and they will help to eliminate from the body, because toxins will damage our organs. Okay, so that is why the metabolism playing important role in that area. And as you said, processed. Okay, you asked one, you used one word, it is called processed. So the liver is processing there. Okay, yeah, it is processing. Actually we will call it first pass and second pass metabolism. There what happens, the chemical compounds will come, a lot of cytochromes enzymes are there, they will come, they will activate the particular compound, they will process, then if it is good thing, then it is circulating all of the bodies and we are getting it. So if it is not good for the health, it will process, directly eliminating.
It means, sir, basically you are saying that liver is the main organ where the drug metabolism happen. So, sir, like some people have compulsive drug-seeking behavior. Like whenever they feel sick or whenever their body goes in the wrong way, they immediately approach to the drug. And sometimes they do these things through online. Like technology is advanced and we are using it at our optimum pace. And sometimes instead of going to the doctor, we are going to internet and we are searching and we are taking a medicine. So, sir, what it leads to? Is it a right approach?
No, of course it is not a right approach.
Right.
How it will be right approach? Then what is the need of healthcare professionals? It's a question mark, right? Why we need? Is there any question? So if you can search in the Google, is there any need of healthcare professionals? No, right? Because we categorized, our medical system is there, doctors are there, everyone is there. The planning, okay, when it comes to the planning, we are using the drugs. Okay, so we are touching the drugs. That time, we are not visiting any doctor. Okay, you are directly going, you are searching the Google and directly going to the medical shop and you are getting the medication. Actually, according to our rule, we segregated according to the schedules. Okay, what we can give without prescription, what drug we can give with prescription. So with prescription also, we are having some rules and regulations. Okay, but people are not following. And you said we are searching in the Google and they're taking the medications. So I'm asking, my question is like, okay, you're searching, so I got a headache. Okay, I'm searching it, headache medications. So it will display 2 or 3 example. Okay, but we are having n number of medication as a analgesics. Okay, analgesics means painkiller. So you're taking for pain. So it will show 2 or 3 examples. So you're seeing that 2 or 3 examples. Mainly I think ibuprofen and naproxen will come generally. So you're going and purchasing the ibuprofen and you're eating. But you are not knowing the ibuprofen is having some contraindication as well, side effects. Okay, that you are not checking. You are going, purchasing, having your problem is rectified, and you are repeating 2 times, 3 times, n number of times, 100 times. Okay, after that, I said liver. Okay, problems will curse. Not only liver, the other organs also getting damaged because it is a chemical compound. So we are not aware of that. Okay, we are only searching the drug. We are going, purchasing, eating. Yeah, headache, khatam ho gaya. That is one case. Okay, normal case, leave it. That is OTC category drug. We can say it is, they can go buy, purchase, have. When it comes to prescribed drug or potent drug, okay, dangerous drug category. So generally nowadays in India, the antibiotics are all available from the shop. Without prescription only, they will give the antibiotics. Actually, we shouldn't give antibiotics without prescription. So they are getting any flu or something. Okay, that time they are going, purchasing. I saw in pharmacy shops, they are purchasing 2 amoxicillin. Okay, only 2 amoxicillin. So 2 in the sense, according to our protocol, amoxicillin or antibiotic should have minimum this time period is this, course is there. Okay, they are purchasing only 2. They are having 2 tablets. Kadam. It is over. They are thinking, I took the medication, that's why I got relief from the flu or fever, whatever it is. But actually it is not like that. Okay, so from there only they are doing the mistake. Okay,
It's amazing. Like basically you are highlighting that each and every drug have their own indication as well as the contraindications, and we should we must take the drugs under the physician or under the pharmacologist, pharmacist. Fine, sir. And the another thing about these drugs is, sir, sometimes what happened, if we take the example of fever, then in the case of fever, sir, generally we approach to some known drugs like the paracetamol. And sometimes maybe a fever is due to the excessive working load. Maybe it can be due to the viral infection, or maybe due to the bacterial infections, or maybe it may be due to the cancer. But generally, whenever we have fever, we go and take the paracetamol. Is it good? What's your opinion, sir?
see, you said that fever. First of all, what is fever? It is increasing the body temperature. Okay, so in our body, one unit is there. Okay, thermo controlling center is there in the body. Okay, that is controlling our body heat, because we need a heat in the body to function other organs. Okay, so there the skin and brain is performing to controlling the temperature. So when the temperature will increase, means when you are pushing into the pressurized condition, okay, that time, or when you are attacked by any external bodies, okay, that time your body temperature will increase. Okay, it is a indication. Actually, increasing the temperature is a indication. So the temperature is telling that our body, hey body, you got something attacking in your body. Okay, so you just take care of it. Okay, just take care of it. Okay, it doesn't mean that go and take the medication. Okay, so we will say 3. The word 3 is having a lot of meaning in the world, you know. It's a Illuminati circle. You know about Illuminati, like it's a triangle. Okay, 3 is a triangle, so everywhere the 3 number is a dangerous number. Actually, in our body also, the 3-day mechanism is there. Okay, if you are attacked by something, wait for 3 days, because the God is designed as like a different level, you know. Do you think in this world AI is best? No. Then who is best?
Human itself.
Human is best, because human found that AI, right? Human is best. The God is designed as like a next level. No one can imagine what is human. Okay, that much complex body is our human system. Okay, so God has already given that recovery, how to recover your body. Okay, that's why we should wait for 3 days. In the case of fever, anything, wait for 3 days, it will recover automatically. If it is not recovering, that means the attacked organ is little bit higher one. Okay, we will play the chess game. Okay, first which one you will move? The friend who will stand friend, the chota coins will be there. No, that only we will move first. Okay, they will try to protect us. If they can't able to protect, then only the behind the big people will stand. Okay, they will come like that. You should wait. If it is not controlling, then only go for the drugs. Please don't go for the drugs. Okay, I'm prescribing, don't go for the drugs.
It's amazing answer. So whenever we have fever, try to wait for 3 days and give the chance to your body to naturally overcome the fever. Fine. And sir, like what happens sometimes, generally in the case of females, her body is different from ours. It is totally different from ours. They undergo the menstrual cycle every month. And so this menstrual cycle it's not an easy process actually. And some female or some girls, they have the pain, which we term as a menstrual cramps. And sir, it's really very disturbing. So you have any suggestion to like how to reduce it, and what are the menstrual hygiene we can adopt?
Actually, it is a natural phenomena. First of all, menstruation cycle is a natural phenomena. So we know how the menstruation is happening. Actually, in monthly once it will happen. It is a 1 to 28 days process. So in that, lot of chemical involvements are there, or hormonal involvements are there in the menstruation cycle. So generally what happens in our hypothalamus, they will secrete one hormone, a chemical substance is called gonadotropin. Okay, yeah, gonadotropin will secrete. What they will do means they will increasing the other hormone secretions like FSH and LH. Okay, follicle stimulating hormones and luteinizing hormone. Okay, so these two hormones are the reason for getting menstruation cycle. Okay, ovary will come, it will processed, and it will waiting for the sperm. If it is not coming, it is going out from the body. That is menstrual cycle. So that time we'll talk about the cramp. Okay, now, okay, so there what happens in our body, one substance is called prostaglandin. Okay, you know what is prostaglandin? It is a hormone like substance or chemical substance which is present in the body. That is the reason of getting cramp. Actually what happened means, so you consider this as a menstrual, like our ovary. Okay, what the prostaglandin will do, the enzyme will secrete and they will catch the wall of what, uterus. Okay, then they will pulling. Okay, the prostaglandin is pulling. Okay, that time how you will do? If you're pulling tightly, how you will feel? You will feel pain, right? So that is how we are getting the cramp. Okay, the muscles. Okay, the muscles are getting contracted. Okay, uterus is getting contracted. That's why the cramp is coming. And mostly the females, they will say, I'm getting stomach pain. Actually, it's not a stomach pain. It is a cramp. Okay, downside the pelvic region, the vaginal cramp is coming because of the prostaglandin. Okay, the prostaglandin is pulling the muscles. Okay, so how we can overcome it? We need to overcome it, right? So generally, people will how they can tolerate. Okay, maximum other small kind of pain are tolerated. Don't go for any treatment or medications. Generally, we can maintain by doing general what to say, exercise activities. Vayama. We'll say Vyayama. Okay, in Sanskrit they will say, so light light exercise, stretching kind of things you can do. That time what happens, your body will secrete like other hormones and thereby the prostaglandin production will decrease. And next one is like you can go for the drinks like cinnamon water you can drink, turmeric water you can drink, and also jaggery water you can drink. That will help to reduce the cramp. And when it comes to chemical, like drug category, okay, so if you can't tolerate the pain, of course you have to take the medications. That's why we intended the medication. The medication category called, first one is you can use general analgesic drugs. Okay, analgesics, ibuprofen, naproxen, that also you can take because it's a pain. Okay, the pain is triggered by prostaglandin, so we are suppressing the prostaglandin. Okay, that you can use, or you can go for the antispasmodic drugs. Okay, generally people know Meftal Spas. Okay, they used to take Meftal Spas last time also. I think January time they announced the control the use of Meftal Spas. It is comes under the category of antispasmodic. Actually, it is a dicholamine content. The chemical content is called dicholamine, and also you can use mefenamic acid. That also antispasmodic drug. That drug you can use will get the relief from the cramp. Okay, that's it. On that drug you can follow it.
So hope viewers got insight to how to reduce the menstrual cramps. Okay, don't go with the drugs directly to the drugs. Use some home remedies as sir described. And sir, like about the medicine, that's one interesting fact, and it's amazed my mind. And that is, sir, a medicine if we take in the right quantity, it can act as a life savior. But when we vary the quantity, it can take away of our life. It can act as a poison.
Quantity matters. Everywhere quantity matters, right? Quality also matters. Okay, not only quantity, the quality also matters. Because see, the drug is designed one. Okay, we are not taking from the like directly like how before they will do like ancient era. They will go to the wild and they will prick some leaves and they will crush it. That time there is no quantity and all. Directly they will take. But here we are making in a chemical manner. Okay, chemically derived. So chemicals, they are dangerous. That's why we did a research, a clinical researchers we set a dose. Okay, we set it. This much dose is enough for particular day or particular duration. Okay, so that particular drug if you are taking, then only you will get the proper outcome of drug output. Okay, I said pharmacokinetic and dynamic. The dynamic means the drug is doing to the body. Okay, if you're taking a particular dose, that time we will call it as a T-off range. So that time the T-off, how it will act, the absorbed drug will going and reach into the particular site and it is binding with the receptors and it will give the effect. Thereby you can rectify your problem. But if you are taking it in a higher quantity, okay, I said it is going, all the things is going to the liver. Okay, if you are taking a higher quantity, our body can recognize, okay, body can't bind with a particular compound and they can't eliminate from the body also, so that they will accumulating and they are causing the higher damages or cell damages, necrosis will happen. So if you are taking a proper quantity, then only it will cure. So you will think, yeah, a doctor said you have to take 1 tablets per day for 3 days. So I will take 3 tablets one day only, then today only I will get cure. It's not like that. Okay, according to our body, we design the drug. Okay, so this drug, this much quantity you are taking, then that day the effect will be there in the body. Next day only next drug should take. Then only we will get the proper thing. In our language we will say, Adhigamayal Amrutam Visham. Okay, in Malayalam language, it means the Amrut, you know, Amrut. If you are taking the Amrut in a more quantity, that will act as a poison. Okay, so whatever you are taking in a correct quantity you should take, not only in the drug, also food you should take in a proper quantity. Per day how much quantity needed, take that much only, because our body is a machine, right? Okay, in mixer grinder you are putting 10 kg of rice and you are grinding, how the machine will respond, right? So overuse or overdosing is harmful. Yeah.
Okay. And sir, like you mentioned one thing, that not only quantity, quality also matter. So sir, when I was child, and there used to be one show called Satyamev Jayate, hosted by superstar Amir Khan. And in that episode, sir, one time one doctor is invited, if I am correct, and his name is Dr. Sumit Sharma. He is IS by profession. He is also holded the doctorate degree. In that podcast, sir, he mentioned that the generic medicine is cheaper and give the same effect as branded medicine does or do. And sir, he is providing the generic medicine at a very low cost in the state of Rajasthan. Now, my question is, sir, if it is so, then why we are not using across the whole country?
Why across all country? In all country we are using it. Okay, we are not knowing. We will talk about India. Okay, we know well known about India. Everywhere in India they are using generic medication.
I don't have idea. No.
Anybody know? Viewers? No idea. Okay. What is generic medication?
Yeah, that's the main question, sir.
How the generic medicine came? What is brand medication?
Brand medication are those medicine which are expensive.
Expensive. Okay. So according to your answer, the brand medicines are expensive, generic are cheaper. Of course, you are correct. But how the generic medicine came? You know, any idea? Don't know. I'll say. First start with the brand. Okay. The brand medicine means actually to market any drug or chemical compound, we need a step. We are having lot of steps. Pre-clinical trial, then clinical trial, post-marketing trials. So in pre-clinical, we are finding one drug. Okay, we are designing one drug. For example, you know which is the first antibiotic in the world?
Yeah, it's if I'm correct, then it is penicillin.
Yeah, good. Penicillin is the first antibiotic. So who found, you know?
It was accidental discovery, and Alexander Fleming.
Yeah, good, very good. So Alexander Fleming is the inventor of the first antibiotic called penicillin. So that time what he did, he found a formulation. Okay, he found a structure where chemicals are having the structure. So he found a chemical formula. Then that chemical formula he tested in animals first. Okay, we need to study in an animal. I'm not saying he did. Generally, I'm talking. So if we are finding any chemical compound, first we will do test on the animals. Okay, we have to do test on the animals. From animals, we will take whatever the adverse effect, whatever the outcome we are getting. Okay, the positive outcome as well negative outcomes will be there. Okay, we are gathering the information. So according to the information, we are improving the drug compound. Again and again, we are improving the drug compound. After improving, we are taking the permission from the FDA. Okay, FDA we have to take, Food and Drug Administration. Also with the help of WHO. Okay, World Health Organization, they will give one approval. After that, we will go to the clinical trials. Okay, there are different, mainly 1, 2, 3 phases will be there. So in the first phase, we will giving into the small quantity of people. Then we are checking the outcome and we are improving the drug again. Then we are giving the second population, like little bit more people. We are giving and we are checking the outcome. But we are giving the different area. We are different the people are staying different area. No, for all them we will get the outcome, because all people are different, right? So we will take the outcome. Then we are going to the third phase. Little more people we are injecting and we are checking. Then only we will get some approval. Yeah, this drug is almost safer in the human, so we can give to all the people. Then it is giving into the market. Okay, so after coming into the market, it is available all the shops, we can use it. And the thing is, for this all the process, we need to take the permission, we need to take the grant, we need to take the patent, lot of expense will be there. Okay, so that is how a drug invented, that is called branded drug. Okay, and that is how branded drug is getting worth. Okay, so now one branded drug got a worth. Okay, so the patent, it is called patent. It is having some particular time of patent. So the FDA or the authority will give the permission. You can use this drug for example, 5 years. You're only having the patent. You know what is patent, right? So permission to handle in a particular person. Okay, so you can handle. No one will take your formula or no one will copy your formula until 5 years. Okay, so till 5 years, that is your drug. You can sell it in any manner, any rate. So I will increase my rate, like that the branded drug is coming. Okay, so after 5 years the patent got ended. Okay, so after that the drug is available for everyone to manufacture. Okay, that is a generic drug is getting birth. Okay, that is how a generic drug is getting the birth. After finishing the patent, the particular drug is coming into the manufacturer by anyone. Okay, not anyone, permission, who is getting the permission, they can formulate. Okay, so that is how the generic drug is formulating, so that the drug is in the cheaper format, because the generic people are not doing the clinical trials. Okay, they are not getting any patent, so expense is not there, so you can give it in a cheaper price. Okay, that's why generic is cheaper, brand is costlier,
But effect is the same.
effect is same. So in what the active ingredient, we will call it as active ingredients. Okay, so the active ingredients means the particular chemical compound which is showing the effect. Okay, that is called active ingredients. The active ingredient will be the same, but the additive compounds will be different. Okay, so for example, we are wearing different kind of branded shirt. Okay, US Polo and Alan Solly, and normal also is there. Shirt is shirt, right? You're wearing, it is looking good. So now also I am wearing non-branded shirt, looking good only, right? You're also wearing non-branded shirt, looking good. But someone is wearing US Polo, same thing, no difference. But the effect and the stitching quality will be different. Okay, the branding emblem will be there. That's why we are giving them more money. But here, little bit the quality, the active ingredient will be same, but the additive, the stitching, the thread will be different. Okay, that is how the difference between generic and branded drug. Okay, so in India, you said in Kolkata it is available, but it is available. Our Pradhan Mantri introduced one scheme like Janaushadhi. Yeah, through Janaushadhi, all over India it is available, I guess, generic drug. But according to the people mind, what you know, if you are taking branded drug, you are getting cure. If you are taking generic drug, you are not getting the effect. It is not like that. Both are having the same effect, but it is belief.
So that's what, sir. Like people have this mentality ki if I'm going to the government hospital and I'm taking the medicine, that's not effective as I go and brought from the outside. Is it good? Like this myth is now false. It means like active ingredients matter.
active ingredient matter. See, paracetamol. Having paracetamol, also you can find sodium, other compounds will be there, addictive. Okay, because we are adding the chemical compound to make the particular drug stable nature, in a stable nature. That's why we are adding the additives. Okay, but the active ingredient will be the same one. Okay, no difference. See, the now the paracetamol is available in different name, Calpol, Dolo, whatever it is available, right? So they are manufacturing under brand name also. They're manufacturing under the generic name also. Okay, it is not a matter. The chemical compound which is acting in the body, that is a matter. Okay, so there I don't, according to me, brand and generic, no difference. And when it comes to the brand, so still some drugs are having under patent. Okay, that drug we should purchase in a branded manner because that is not available in the generic form. Okay, that time we have to depend in the brand. Okay, so that is a difference actually.
Yeah. And so like in this modern era, in modern environment, a drug play a huge role to maintaining a life. But sometimes what happens, people misuse the drugs. And unfortunately, they become addictive. They become addictive to certain drugs. So my question is, sir, that what are the ways to cure this addiction? And also, sir, like when I heard from some certain research and I studied I reviewed the papers and I got to know that these drugs, when you try to detach from those addictions, then you have the withdrawal symptoms. And people priorly, they heard, they learn, and they're in a fear. Okay, if I am taking this drug, if I suddenly stop it, I will have these symptoms. So clinically, how you manage the addictive person cases?
See, when we're talking about the addiction, it is kind of adaptation. Okay, you are adapting to the particular substance. Okay, so not only drugs. Okay, you said about the drugs. Generally, I'll talk. Okay, some in my case also, I think in 2021, that time I'm addicted to Happy Fizz. That's a normal juice. Okay, I'm addicted to Happy Fizz. Daily I want to drink 10 rupees ka Happy Fizz. Then only I will get the sleep. Okay, so our body is adapting to the particular substance. Okay, it is called addiction. Okay, so when it comes to the drug, generally people are not addicting to the drug. Okay, because I said no, a physician is prescribing the drug for a particular time period. Okay, so when they are misusing the prescription, that time only the person is entering into the addiction category. And one more thing is generally long-term drug use will be there. Okay, in case of diabetic mellitus and hypertension, so that time they have to use a drug, okay, for a longer period, like we will say more than 3 months if they are using, so they are into the long-term treatment. So that time they will addict to the particular drug. If the person is taking the particular drug on particular day, their BP will increase or their sugar will increase. Okay, that is one category. And mostly we have to focus that we shouldn't go for the drug. Okay, non-drug therapy is there. No, before you mentioned the drug, we are more into the drugs. We are not more into the drugs, chemical compounds. Okay, we can cure the condition without medication also. Then why the Siddha medicine is available? Why the Ayurveda system of medication is available? Why the Unani is available? Why? Why only our allopathy is in the highest position? Ever you thought?
Maybe the one reason it's immediate act, give the immediate response.
All are in the urgency. Okay, we shouldn't be urgent. Nowadays I think UK and Germany and all, they are more focusing into the Ayurveda system. Okay, because they don't want nowadays our allopathy system. Okay, that's why we are having, other than medication, the therapy setups are there. Okay, we have to utilize it. We are not utilizing it. Okay, so see, if you are going for that non-drug therapies, so where the addiction will come? No addiction. Okay, if you are depending to the particular substance. Okay, that's why the addiction is coming. Okay, so if you are getting BP, don't keep that in your mind. Okay, I said physically and mentally. So mentally you are setting it. Okay, so I got a BP, I will die. If I'm not taking drug, okay, I'll die. Okay, it is not like that. You can control the BP by some other activities. You can do yoga. Okay, you can practice some light exercises. You can change your food habits. right? Why BP is coming? Find that why it is coming, and also diabetic, why it is coming. Your life habits, life cycle, right? If you're following this and all, there is no chance of addiction. And if the patient is getting addiction, your question is like, if the patient is getting addiction with the drug, how we can overcome it? Okay, for that, if you want to change from the particular addiction, you have to get addicted to some other things. Then only that addiction will go. Okay, addiction is like a ghost. Okay, it will follow you. According to me, medically also, so generally we will say is the tobacco use, we will use nicotine. Nicotine is a drug, right? So daily you have to take the nicotine. So here, getting addicted to the nicotine instead of tobacco. So addiction will follow you. Okay, so if you want to relieve from the addiction, you have to get addiction with some other substance. That is my answer.
That's really amazing. And son, as you mentioned, that apart from the chemical drugs, there are other ways to treat the patient which is not addictive. And so previously I was engaged with one psychiatrist in our previous podcast, and in that podcast, sir, he clearly mentions that in the case of psychiatric disease management, a therapy is a better option. What do you thought, sir?
Yeah, of course it is a better option. Okay, see how the psychiatric patient is getting birth, how they are having psychiatric conditions. Any idea? We only saying that yeah, they are a psychiatric patients. Okay, we will keep them away, right? In family also, like some family will support them. Okay, they will stand with the particular patient, but some family will be like, you are having this problem, we won't come with you. Like that they will talk. Okay, how the psychiatric patient is getting birth, how they are creating, how the psychiatric condition is happening, because of the society. Okay, because of the society. Psychiatric condition means they are getting fear to something, and they are fear to go with a crowded area, right? There is a psychiatric conditions. We are having a lot of psychiatric like schizophrenia, delirium, anxiety, so on is there. Okay, that time if you are using the drugs, use it non-drug therapy is better. Okay, so I'll say if we are using the drug, so that time what happen means the particular time period only the drug will act in your body and it will give the calming effect. Okay, if you're stopping the drug,
Again, the same.
it will come, right? So better to go the drug or non-drug therapy, because non-drug therapy like psychiatric condition means socially you are not comfortable. That is a psychiatric condition. So we should make the particular patient become comfort with the society. Okay, then only 50% of the psychiatric symptoms will go off from the particular patients. Okay, so we have to give the counsel, we have to say them these are the things you can practice. Okay, life cycle you can change. Okay, you interact with some like kind of people. Okay, this kind of people you can involve, or you can involve in the sports, or you can involve in the particular activity. Okay, that time the thoughts will go, yeah, that particular patient will be, I said, no addiction, they're getting to the particular substance. Okay, or particular things they are focusing. That time they will forget about the anxiety or whatever it is. That is how we have to treat. Okay, the 50-50 is a 50-50. Okay, if it is required, then only go for the psychiatric drugs and all. And also we are having a category of drugs. Okay, generally we won't use antipsychotic agents for the psychiatric patients. Okay, we will start with the benzodiazepines and all. Okay, we'll start with that particular drug, then only we will touch with the antipsychotic agents. Okay, so first we have to give the counseling therapy. Psychologists are there. You can meet the psychologists. They will give the new ideas how to the life change behaviors. You can follow it, thereby you can rectify it.
And this is amazing. Means basically you are saying, sir, that not always chemicals are important. Sometimes non-chemicals management is best. Oh, okay. And sir, as I said you that I done one small survey, online survey, and in that survey, sir, I got one amazing question. And that question is, sir, that there are one people who is taking adequate sleep, but still he feel tired and sleepy, and if he paying the attention about their previous history, then when he is sick, he was on sleeping pills, and he is asking basically that what's wrong going in his body, and what is the way to.
So that you are saying that the particular patient is getting sleep, sufficient sleep he is getting, then also he is feeling to sleep or tiredness again, and previous therapy he took some sleeping
Prescribed by the doctor.
like any idea why he took a sleeping drug? No idea. Okay. So for that, we don't know why he took the drug. Generally, I'll say, see, our sleeping is 7 to 8 hours. We should sleep. Again, if you're getting more tired or sleepiness, means your body is not having particular nutrition substance. Like we can say it as vitamins, vitamin B12. Okay. Then magnesium is important compound for getting sleep and healthy things, and potassium, low level of sodium. Okay, these are the substance will make you feel very weak, fatigue condition. Okay, if you are very weak, feeling tired, of course you will get sleep, because the substance, how you are getting sleep, one substance will produce in the body at the night time, in the dark.
It's melatonin.
Melatonin. Okay, the substance which will produce in the body, that will trigger us to get sleep. Okay, so in your body we are not having a sufficient amount of these are the nutritions. Of course, the melanin production will be there. You will get sleep. Okay, there is one case. So that patient, he can go and check the blood once. Okay, he can check these are the content is there in the blood or not. Okay, then he can go for the future therapy. Okay, because we don't know why he used the sleeping pill. Actually, sleeping pill in the sense it is not there. Okay, you know what is sleeping pill? We will say sleeping pill. Actually, sleeping pill, there is a side effect. You are getting the sleep. You know which drug we are using generally?
Sedative drugs.
Which category? Actually, low dose of benzodiazepines we are using as a sleeping pill. The side effect of benzodiazepine is tiredness of sleeping. Okay, so what? You are taking some other category drug, and the side effect you are getting the sleeping. So please, next time people who are taking sleeping pills, please don't take the sleeping pill. Okay, so if you are not getting the sleep, drink some juices, cool drinks. Okay, make your body cool. Automatically the melanin produce, and you will get the sleep. And keep your device, phone and all away from your bed. Okay, like that you will get the sleep. Please don't go for the sleeping pill, because it is a benzodiazepines. We are using benzodiazepine for seizures, mental illness. So people who are taking sleeping pill, they are mental patient. No, right? Then why they are taking the benzodiazepine sleeping pill? Please stop taking benzodiazepine. Okay, that is my suggestion.
And sir, one question I want to more discuss, and that question is acidity is common in nowadays. Okay, and generally people took the drug for managing the acidity. Is any other way to manage it?
Yeah, acidity managing in the sense, see, I said no, for everything, first of all, don't run for the drugs. Okay, first see why you got acidity or why you got the particular medical condition. First analyze that. Okay, why you got it, how you got it. Okay, then go for the treatment. Generally, the public is like, I'm getting acidity, I'll go to the medical shop, I'll buy some medical like antacids or something, I'll drink, I'll get rectified. But that particular patient is not thinking that why I got acidity. Okay, because maybe he had some food, acidic food, because of that he got acidity. So if he is generally stopping the particular food, normally acidity will go off. There is no need of going any drug. Is there need of taking any drug? No, right? So acidity in the sense forming the acid or increasing the acid content in your body. Okay, in our body we are having HCl. Already the stomach we are having HCl for the digestion purpose. So there, when it is increasing more, that time you will feel the bloating sensation will come. You will feel the discomfort, chest pain will come. Of course you will go for the treatment. My suggestion is that don't go for the drug. Use ginger or natural remedies. Okay, you can follow the natural remedies that will rectify your gastric problems. So if you next time if you are feeling more gastric problem, drink thoda salt water. Because acid will neutralized by base. Salt is a base, so we are neutralizing with the base. So next time don't waste your money. Okay.
So sir, now let's move towards some questions, and which we are going to answer in a rapid way. Okay. The first question sir I got is that is there any medicine to prevent hair loss?
Prevent air loss means we can't prevent the air loss, but we can control it with some chemical compound. Nowadays, one compound is available. It is called finasteride. Okay, that compound is available in the brand name of Osaka or something. Okay, brand name is available. Actually, the drug is this thing. Okay, 5-alpha reductase inhibitors. Thereby, we can reduce the loss of hair loss. Okay, and also it is using for BPH, benign hyperplasia or something. We are using the drug. Okay, and also minoxidil you can use. Okay.
Can I pursue to become anesthesiologist after Pharm D?
For that, I'll take 2 words. Okay, actually, PharmD is a different world. Okay, and if you wanna become anesthesiologist, you can become by doing the masters or studying the course. 1 or 2 years you have to study it anesthesiology. Then you can become an anesthesiologist.
Which area of pharmaceutical research are currently most promising?
Okay, so it is not like a particular area. We are focusing in all the field like cardiology, renal, and also nowadays we are focusing on the artificial intelligence. Okay, you know, in China and all, they are using for diagnostic features. They are using the early detecting the cancer cells by using the artificial intelligence devices. So there we are focusing more. Okay, devices we are focusing more, and also advanced drug. And nowadays we are focusing on the antibiotic invention also.
And is it necessary to take antibiotic for a certain period, or could it be discontinued after patient feel better?
That is a good question. See, when it comes to antibiotic, we are having the particular course. Okay, you have to follow the course. If you're not following, resistance will happen. That will kill you in the future. Okay, you will become a patient.
Which are the example of prescription stimulant misuse?
Prescription stimulant misuse means, as I said, the doctor is giving the prescription, and the prescription is having the expiry date. Okay, so after the expiry date also they will go and purchase particular drug. There is a kind of misusing the prescription. Generally, I am saying in antidepressants. Okay, benzodiazepine drugs are misusing, like sleeping pills. Okay, yeah, that is a commonly used drug.
So by this, sir, we are done with the questions, and viewers got the insight from our today's podcast, and I am, sir, really very blessed to have you, and we have, sir, a small gift for you. Sir, please have it.
Thank you so much. Yeah, thanks for inviting in your clinical care insights. So we had a lot of healthy discussions. Keep going on. Okay, we will do more conversations. Okay, thank you.
Thank you for having us. Bye.